Hello and welcome to Wellness Live. My name is Dr. Olivia Moses, and this broadcast is brought to you by Loma University Health's Department of Risk Management. Well, if you're joining us live today, please make sure we call this Wellness Live because you can ask questions live to our guest speakers. So go ahead and type those questions in the comment section, and we will make sure to get to as many of them as we can. Today, we are talking about health plans. Now, some of you might think, wow, health plans. There's too much to know. It's overwhelming. Well, what today we're going to do is going to break some things down to you. And it really doesn't have to be that intimidating. Our special guest today is Mark Hubbard. He is the Senior Vice President here at Loma University Health, and he has worked for the organization for 38 years. Now, many of you who are regular viewers of Wellness Live know that this is brought to you by the Department of Risk Management. That's one of the hats that Mark wears here, and he runs the health plan that we offer to our employees. So he's the perfect one to talk to us about the health plan, or a health plan in everyone's case. So without further ado, I'd like to introduce you to my boss, Mark Hubbard.
Thank you for the introduction, Olivia. I'll go ahead and share my screen here. We're going to talk today about understanding your health plan. Cheers. So we're going to talk a little bit about health insurance. This is a topic that probably a lot of people are not particularly enthusiastic about discussing, but it's certainly an important topic for everybody. Some of our objectives this afternoon are to understand the types of different plans that are out there and some of the eligibility requirements. We'll define some health plan terms. We'll also talk about, what you need to look for if you're selecting a health plan. Talk a little bit about the enrollment process, what's important, and then also how do you make sure that you maximize your benefits under your plan. So you may say, well, why is health insurance so important? And one of the issues, of course, is financial. As referenced here, this is a Harvard study. It showed that 62% of all personal bankruptcies in the United States are the result of outstanding medical expenses. It's really the number one reason why individuals in the United States declare bankruptcy. And then secondly, and maybe even more importantly, if you or a family member experience an illness or an injury, or that your treatment options as you go forward and your access to services, your selection of physician is going to be impacted by your choice of health plan. So you want to evaluate your plan and prior to the time that you would have this sort of catastrophic event in your life. You just don't want to wait until you're in the middle of that sort of a crisis before you start understanding, what your health plan will cover and what it won't. So in terms of health insurance, we typically think of a medical plan. A medical plan would usually cover office visits, outpatient services, diagnostic services like X-ray and laboratory services, and then also would cover, of course, hospitalization. Plans often include some other coverages, though, as well, including things like prescription drug coverage. This may or may not be included in your plan. Sometimes plans also provide vision benefits that would include both things like a vision exam as well as possibly glasses and contact lenses. But in some cases, it's a separate policy, and the same is true for dental coverage. Oftentimes, the medical plan or the health plan may include dental coverage. In other instances, it's a separate plan. So in terms of where do people get their healthcare coverage, this just confirms that this data from a government study, and it showed that as of 2020, the majority of people in the United States still get their healthcare coverage through an employer-sponsored plan, as shown here. You can see Medicaid is the next most common source of coverage at 20%, and these amounts, of course, vary a fair amount from state to state. We have some states like California where we expanded Medi-Cal eligibility following the adoption of the Affordable Care Act, and so the Medicaid eligibility in California is actually quite high, or much higher than this national average. But you can see again that employer-sponsored plans are the primary source of coverage for most people. Then, of course, there's also Medicare for individuals over the age of 65. There's government plans. There's still a segment of the U.S. population that is uninsured. And then, of course, we have some people self-employed often that buy individual policies. So all of these plans have some important terms. It's really important for you to understand. One is a deductible. So the deductible amount under a health plan is the amount that you have to pay as a health plan member before the plan will pay anything. So this is essentially, you don't have insurance until you've really satisfied that deductible expense. Then there are co-payments, and these are typically flat dollar amounts that you pay each time you go to the doctor's office or each time you obtain therapy or some other service. Those amounts range. It could be $5, might be $20, could be $40. The amounts vary depending on the plan. And then there's also what's called co-insurance. So co-insurance is a percentage. So this is a percentage that you have to pay as a health plan member with the balance of the expense being paid by the plan. And then finally, we have what is called an out-of-pocket maximum. So this is protection that you have as a health plan member. This caps the total amount of out-of-pocket expense that you're expected to pay each calendar year. And you can see that that would include things like the deductible amounts that you have to pay, any co-payments, and co-insurance amounts. Now, it won't cover things that are otherwise not covered by the plan. So if you have some expense that was excluded under the plan, that wouldn't accumulate towards your out-of-pocket maximum. But the important thing is that this, again, caps the maximum financial exposure that you have as a health plan member. So there are a variety of different types of plans, and they can be kind of confusing. Some employers provide one plan, some employers provide multiple plans that make multiple choices available to their employees. So when you're looking at your plan, it's really important to understand, some of the basic plan design features. So in California and across the country, one type of program that's pretty prevalent is a health maintenance organization or a managed care plan or an HMO. With this type of plan, as you enroll in the plan, you have to designate a primary care physician to manage your care. And that's an important thing to keep in mind when you enroll in an HMO. You're really contracting with that plan to manage your care. You're no longer in a position to decide, when you obtain services or where you obtain services. You'll need an authorization for any referrals. That would include if you need to be referred to a specialist or if you need diagnostic services or therapy or surgery or a hospitalization. All these things, you have to seek approval through the plan, typically through your primary care provider. There's also a plan, and this is actually the most common type of employer-sponsored plan called a PPO or Preferred Provider Organization. With the preferred provider model, there's a limited hospital and provider network. So the plan is contracted with a specific group of hospitals and physicians. And if you go to those designated providers, you get pretty good coverage under the plan. But if for some reason you choose to obtain elective services outside of that network, you typically have much higher out-of-pocket costs, typically a much higher co-insurance requirement if you seek services out of network. Then there's also an even more restrictive model, which is called an exclusive provider organization or an EPO. And this is where you're restricted for coverage under the plan. You must go to the hospital or physicians that are in that provider network. And if you choose to go out of that network for any reason, you have no coverage at all. There's also a plan that's sort of a hybrid called a point of service plan. And it's really a kind of a blend between an HMO and a PPO design. And under this model, you designate a primary care provider. And again, as with an HMO, you have to obtain especially referrals for in-network services, but you have the option of going out if for some reason you feel compelled to seek services outside of the provider network, and you still get coverage, but it's subject to again, higher co-payments and co-insurance requirements. And then finally, we've got a so-called high deductible plan, and this has become much more popular in the last decade. The arrangement here is that the plan adopts a very high deductible, somewhere between, say, $1,500 to up to $7,500 per individual per year. Now, the reason these plans have become more prevalent is that they have lower premiums, and that's, of course, because the plan doesn't cover the first $1,500 or up to $7,500 of expense. You have to pay that out of pocket. Now, with this arrangement, a lot of employer plans also provide what's called an HSA or a health savings account. And through the HSA, the employer provides some funding. They typically don't fully fund the deductible amount, but they provide a contribution toward that amount that goes into the savings account that is available to the employee to utilize when they do incur expenses. And this is all referred to, this type of model is referred to as a so-called consumer-driven health plan. And the rationale here is that when consumers are faced with paying for these medical costs out of pocket, they'll make good choices. They'll make more cost-effective choices in where they seek services and when and how they seek services. And this kind of a high deductible model really can be built into any of the plans that we talked about earlier, an HMO, PPO, EPO, or even a point of service plan. So these are all the different types of plans that employers sponsor.
Okay, well, thank you, Mark. There's a lot of information here. So why don't we get into some questions? So if you have any questions for Mark and you're watching us live, please go ahead and type them in. So Mark, a question that we wanted to ask and that has come up now is about what if I change my employer? So I'm getting coverage through my employer and now I got a new job, but there is a lag between me leaving my current position and getting the new job. So what happens then?
So it's really important. One of the things I think hopefully people take away from this conversation is that you absolutely do not want to have a gap in your health insurance coverage. It's extremely important that you maintain continuous coverage and avoid any period of time during which you're not insured, because if something were to occur during that time, an accident, for instance, it could be a financial catastrophe, for your family. And so you have a couple of options. If you're in between jobs, this is the reason why the federal government adopted what is commonly referred to as COBRA legislation many years ago. And COBRA provides the opportunity for you to extend your health plan coverage, depending on the circumstances, either 18 or up to 36 months. So if your spouse becomes eligible for Medicare, or if you go through a divorce, or if you're an adult child and you lose coverage under your parents' plan, those are all events that make you eligible for COBRA coverage. And when those events occur, if you notify the plan, they will send you what is called a COBRA notice. And you have typically 45 days to make an election, decide whether or not, or actually I think 90 days to make an election. And then beyond that, you have additional time to actually pay the premium. So you want to make sure when you're transitioning that you look at that COBRA notice, understand what your cost would be for that plan, and that you make the election within the defined time period. You just want to make sure you don't have a gap in coverage. And COBRA coverage can be expensive though, because under COBRA you're required to pay the full cost of the plan. So that would, if you're leaving your employment, it would be the amount both that the employer has been contributing as well as the amount that you've been contributing to the plan. So it's typically fairly expensive, but it's very important that you not wind up in a scenario where you're uninsured for a period of time. And even though the federal government individual mandate that you maintain health insurance has been suspended, under California law, there is a mandate that everybody who resides in California has to maintain health insurance.
Thank you. We have a question coming in from YouTube, Mark, and we talked about the different types of health plans, and a lot of people know that we have the Department of Risk Management here. So the question exactly is, what type of plan is risk management?
So on our campus, we offer a preferred provider plan. And that means, of course, that you get the best coverage under our plan if you seek services within our Loma provider network. It's really a shared savings model because it's less expensive for us to deliver healthcare services within our system. We share that savings with our workforce by providing 100% coverage, for instance, on hospitalization. We provide 100% coverage with no deductible on diagnostic services as well. So we provide very good coverage. We share that savings that we derive by delivering services on our own campus through that PPO model, but it still provides the opportunity for someone to go off campus or outside of our provider network if they feel a need to get services off campus. We also do have some areas where we've contracted with community providers, so our provider network actually goes a little bit beyond our own campus, but we do maintain that and have had that preferred provider model in place for many, many years.
Well, thank you. So one last question before we get into the second half of your presentation is, we've talked about employer-sponsored health plans in this first half. What happens when a person retires?
So the good news is that most people are going to be eligible for Medicare, assuming they retire and they're beyond age 65. And so if you've contributed into the Medicare system, if you've been employed in the United States at least for at least 10 years, then you're fully eligible for Medicare Part A, which is the hospitalization portion, for free. And then you do have to pay for Part B coverage, but there's lots of Medicare options that I'll talk about a little bit later, at least at a high level. But the great news is that for people that are retiring, they have access to Medicare supplements, and managed Medicare plans that provide very good coverage and will take care of somebody once they are beyond age 65.
Well, thank you so much. Why don't we get to the second half of your presentation?
Okay. So as we just talked about, the most prevalent type of coverage that's available is your employer group health plan. But you should also note that when you're trying to decide, where do you get your insurance, you may be eligible, and very likely you would be eligible under your spouse's group plan as well. If you're, again, under age 26, there's also a possibility that you could enroll under your parents' plan. And that's true even if you have your own employment and access to your own group health plan. You still typically have the option of enrolling through your parents' plan under those circumstances. There's also provisions for a disabled child to be covered beyond age 26. Another consideration for people is, am I eligible or should I enroll in Covered California? This is the marketplace that was created with the adoption of the Affordable Care Act back in 2010. So in California, we have what is called Covered California. The important thing to note here is that through Covered California, you may also be eligible for a federal subsidy. About 85% of the individuals that are currently enrolled in a Covered California plan are receiving some form of a federal subsidy that can be up to the entire premium that you would otherwise be expected to pay through Covered California. So it's another option that individuals might be considered, particularly if they're a lower wage earner. Then there are, as I mentioned in the earlier slide, there is a small number of people that do buy individual insurance plans, or if you're self-employed, for instance, you may be purchasing an individual policy. And then, of course, there's the state Medicaid program here in California called Medi-Cal. And again, the Medi-Cal eligibility criteria has really expanded in the last several years. So a much greater number of people are eligible for Medi-Cal than what might have been true, years ago. And then finally, there's the Medicare that we talked about briefly in terms of employees that are over the age of 65. So when you're looking at options and considering a health plan, some of the things that you really want to carefully evaluate, first of all, of course, being the monthly premium, how much do I have to pay for coverage? And, that payment would typically through an employer plan be made via payroll deduction. And the good news about that expense is that it's predictable. I mean, in advance typically for the year, how much you're going to pay, how much you're going to have withheld from your paycheck. And that the other big advantage is that amount is typically also funded on a pre-tax basis. So you save the expense that would otherwise be incurred if you were paying with after-tax dollars. And another important consideration, of course, is the out-of-pocket cost, the things we talked about earlier, deductibles, the amount that the plan does not cover that you're obligated to pay, the co-insurance amounts that you may pay out of pocket, as well as co-payments. And again, the challenge with this is that those costs are, of course, unpredictable. You may be a young, healthy person. You don't really expect to incur any expenses. But you or struggle because of an accident, you wind up needing medical services. And so suddenly you have what would be an unexpected, cost for a deductible, for instance. You're also going to want to look very carefully at the provider network. is you want to know, is my doctor, my healthcare provider included in the plan? There's typically an online provider network. So when you're evaluating a plan, considering enrollment, you can typically go online and do a search and pretty quickly determine whether or not a provider that you may be wanting to connect with is in that plan or not. You also want to consider, the number of established provider relationships that you have. If you're an individual who's struggling with chronic disease and you have 3 or 4 specialist relationships already, then it becomes really important for you to verify whether or not those providers are included, in the provider network for that particular plan. Another thing that you want to look at is if you're taking prescription drugs, maintenance drugs, particularly high cost drugs, you're also going to want to verify whether or not your drug is covered under the prescription drug formulary for that plan. All plans have a list of drugs that they cover and a list that they do not. And so if you're dependent upon one of these medications, you really want to make sure that that's available through your plan, or else you're going to be faced with making a change in your medication regimen. And then also, you'll want to consider, am I in a situation where I've already received authorization through my existing plan to get therapy or some other service? And do I want to go back through that process and seek authorization if I switch plans to go to a new program? And those are all just some of the considerations that you're going to want to look at as you're evaluating your plan options. And typically, these plans all have trade-offs. If you elect a plan with lower monthly premiums, it's typically going to have higher out-of-pocket costs. So the reason for the lower premium is that the plan covers fewer expenses that you would otherwise be expected to cover. And then if you want a plan that has greater choice, where you can select your provider, you have much more freedom to obtain services wherever you want, those plans typically have a higher cost. And so again, these are part of the trade-offs that each person has to evaluate based on your personal circumstances. So if you're a younger and healthy person, you may want to focus more on lower premiums. Maybe you have a lower income, you're early in your career, and you're not expecting to incur any medical expenses. You may be very comfortable with a high deductible and co-payments and a very limited provider network, because perhaps you don't even have an established relationship with a primary care provider. And of course, if you go through the year and you never incur any medical expenses, then a high deductible plan really doesn't impact you. So that would typically be the type of choice that a younger person might make. And then if you're an older individual or somebody who's struggling with health challenges, you may be willing to pay a little bit higher premium to make sure that you have the provider of your choice. You're also, know that you're going to be incurring costs throughout the year. So you're going to want to try to minimize those deductibles and coinsurance amounts. You're going to want to probably select a plan that provides more comprehensive coverage. And then again, as I mentioned, you're also going to want to make sure that your provider that you've already established with is, included in the plan. A couple of really important things to remember when you're going to enroll. So if you've selected a plan and now you've decided to go ahead and enroll in this plan, bear in mind that there's time limits, and these are fairly rigid. The federal government requires an employer-sponsored plan to follow a very strict set of guidelines around the plan provisions. The employers are not supposed to, simply make exceptions to the plan rules. And most plans have like a 30-day timeline. So when you become eligible, you need to enroll typically within a 30-day window. Now you can make changes during open enrollment, and open enrollment is something that only occurs once a year. So if you miss the initial enrollment opportunity when you're hired, say in a July timeframe, you may have to wait until January of the following year to enroll in the plan. There is a provision in all of these plans that allows for the so-called special enrollment. So if you get married, or if you have a child, if you become separated or divorced, those are all what are called special enrollment events. And that allows you during a specific period of time, a limited period of time again, to make changes. So at that point, you can move to your spouse's plan, or you can place a newborn child on your plan. So you can make these types of changes. But outside of open enrollment, the only time that you can make a change typically is with that special enrollment event. And of course, when you have those changes, then that would be the time for you to start again comparing to your spouse's plan, looking at the issues we talked about earlier, the monthly cost, deductibles, and co-payments, and so on. One of the things I would really, I think, important to emphasize is to read your summary plan description. So every plan is required to produce a so-called summary plan description, which provides information about your plan in layman's terms. It's really not a lot of legalese. It's something that everybody can understand. And it covers a lot of really important features in your plan, including things like, what is the provider network that you may be limited to to maximize coverage? It will also describe in detail, your deductibles, your co-insurance, and any sort of co-payment requirements. And then finally, it will also include, the process for how you obtain prior authorization for services or referrals outside of the provider network, or, outside of your primary care provider. So these are all really important things for you to understand prior to the time that you need your health plan. And again, they're very well described typically in these documents. So I would just encourage you not to be intimidated. This documentation is readily available typically online. It's pretty easy to read and understand. And it's really important for you to know what your healthcare plan will cover when you need it. Another thing that's addressed in these documents is also an appeals process. So if you're enrolled in a health plan, it's important to know that every health plan member has the right to an appeal or appeal decisions if their coverage is denied for one reason or another. Through that process, the plan will provide very detailed information on the basis for the denial and what your options are, what your additional appeals options may be. And this whole process is really intended to assure that somebody who's covered by a plan gets a full and fair review of the denial. And depending on the circumstances, that process may overturn the decision of the plan and provide coverage that had previously been denied. Another important thing to keep in mind, similar to losing your employment, is disability leave. So if you become disabled while you're covered, and particularly under a group health plan, and you're no longer at work, one of the things that you want to make sure you understand is how do you continue your coverage when you're away from work on disability leave? How do you pay your health plan contribution when you're absent? Some employers will allow you to continue to do that through payroll deductions if you're receiving, paid time off or sick leave of some sort. But once you've exhausted your sick leave, you're no longer getting a paycheck. You still are obligated to pay that monthly contribution. And it's really important that you don't allow that coverage to lapse, particularly when you're struggling with a disability. That's the time when, of course, you need your health plan the most. And so you want to make sure that as you're reading through this documentation that you clearly understand, how do I manage the process when I'm out on a disability leave? So just a couple of quick comments about Medicare. As I mentioned earlier, that Medicare is the coverage available for anyone over the age of 65. I do know a lot of people get concerned, when they're going to lose their group healthcare coverage from their employer. And the good news is Medicare provides good coverage. There are deductibles and co-payments as referenced here, and it's broken up. Medicare is broken up into divided parts. There's Part A, which is hospitalization. That's the part that's free to anyone who's contributed in the past. Part B is the medical insurance, or it covers things like outpatient office visits. And there is a premium for that Part B premium, or that Part B coverage when you enroll in Medicare at age 65 or beyond. But you want to make sure that you enroll when you turn 65. So specifically Part A, because there's no cost to you, you want to enroll in Part A when you turn 65. Part B and Part D, the prescription drug coverage, you can wait until you are no longer covered under your group health plan. You do have to maintain what is called creditable coverage during the time that you're beyond age 65. But if you're getting creditable coverage through your employer, then you don't need to enroll in Part B or in Part D until such time as you lose your group health care coverage. But after you lose that group coverage, again, you want to make absolutely sure that you enroll in Part B and or Part D, because if you don't enroll, you're penalized through the Medicare system. And it's not a one-year penalty. It's a penalty that you pay for the rest of your life. So again, it's very important. And there's lots of really, really good information online, videos and so on. That Medicare has done a great job of providing information to retirees. So, as you're approaching your retirement age, I would encourage you not to wait till you turn 65, but before then, start doing a little bit of homework to understand what your options are. And then, as referenced here, there is something called Part C, otherwise known as Medicare Advantage. This is basically an HMO model. So you sign up for Medicare Advantage, and that plan will manage all of your care. And typically, it also provides enhanced coverage. So you may get vision care or coverage for glasses or hearing aids, things that are not covered under traditional or standard Medicare. So again, I mentioned that the important thing is to enroll again at age 65 for Part A, and you get that coverage for free. And this shows you there's a range of premiums that's means tested. So based on your income, you may be required to pay more for Part B coverage. And then when you enroll, you also have the option of buying supplemental insurance, what's otherwise referred to as Medigap insurance. And there's 10 standardized plans as defined by the federal government, and it fills in those deductibles. So if you don't want to be faced with the prospect of those deductibles, you have the option of buying a number of options for so-called Medigap coverage. Quick remark about Medi-Cal. Again, Medi-Cal's the state Medicaid program and provides coverage for becomes eligible for anybody that is earning up to 138% of the federal poverty level. Here in our region, the managed care provider for Medi-Cal is Inland Empire Health Plan. And in our region, a very sizable percentage of the total population are actually eligible for Medi-Cal. And Medi-Cal provides very comprehensive coverage with little or no cost to the member. So as you're evaluating options, particularly if you're in between jobs or you're a low wage earner, you may very well be eligible for Medi-Cal. And again, there's lots of information available online about that, about who's eligible and who's not. Then there's also the California Exchange. So we talked about this a little bit earlier. And as I mentioned, the majority of the people that are enrolled in the exchange are getting a subsidy. So that helps them to pay what would otherwise be a much higher monthly premium. And there's, again, a range of plans offered by a variety of different insurance companies. But the great news is, following the Affordable Care Act, there's coverage is widely available for people. So no one has to go without insurance, whether that's through Medi-Cal or the exchange. There are lots of really good insurance options that provide good coverage for an individual. So I guess the just final remarks is, don't be intimidated. A lot of people, are petrified about having to sit down and actually look at an insurance program or insurance summary plan description. It's really important that you understand your plan and that you've read through that information. It's, again, in pretty user-friendly language typically. And there's lots of information available online, and you just don't want to ignore this because, if you make the wrong choices or if you're unaware of the requirements of your plan, it could put you at financial risk. So I just encourage you, if you haven't done so already, to spend the time going out looking at your health plan document and at least have a basic understanding of your plan.
Well, thank you so much, Mark. There was a lot of information here, and we have a question also coming through, but could you speak a little bit to, and I know you and I talk about this too in our work, is it's always important to understand your health plan before an emergency happens, because when you're trying to really understand it, when you need the health plan the most, it's a very stressful time, and that's really kind of not a great scenario for the member.
Yeah, absolutely. That's, you want to have the time to thoughtfully read through the material and understand, for example, what provider do I need to obtain services from? If you're not aware that you have a limited provider network, for example, you might obtain services outside of that network and then be faced with some substantial out-of-pocket costs that you didn't expect. And there's, again, prior authorization requirements for some services depending on the plan. HMOs typically, you don't have the option of just going out and obtaining diagnostic services. Those have to be authorized. So if a patient makes a mistake and just goes out and receives services without the authorization, then they're faced with paying those expenses out of pocket. So it's important to understand kind of the ground rules for your plan, before you're faced with having to incur those kind of medical expenses.
Right. It's just important to set just a little time aside in your day to kind of read over these things. So when an emergency does happen, you're kind of prepared and know the steps. Um, what happens, Mark, when someone travels?
So again, there's been some good consumer protection legislation that's been adopted by the federal government in recent years. And one of those is referred to as the No Surprises Act. And so when you're out of area, most plans have a provision that says that if you receive emergency services out of network, you still get good coverage under your plan. You're not subject to, the out of network penalties that would otherwise apply if you were making an elected choice to go out of network. But one of the issues that used to be a challenge for patients is that they would obtain services out of network and their plan would provide reimbursement, but it wouldn't cover necessarily all the costs. And they were often faced with so-called balance billing. So there would be an out-of-network provider that might have an excessive fee. And when the plan limited their payment to more reasonable charge, that there was then an argument between the provider and the patient about who's going to pay the balance. And oftentimes patients would wind up being turned into collections if they didn't pay that higher expense. That's now all been prohibited under this new No Surprises Act. So when you receive emergency services anywhere in the country, or even for that matter out of the country, if you're faced with these balance billing issues, the provider is prohibited from trying to collect from you. They have to work that out with the health plan. So there's a whole new process that the federal government has established for that issue to be resolved between the plan and the provider. And so that's been great news for consumers. But generally speaking, you'll have coverage, out of the area for emergency services. And again, the penalties that would otherwise apply for out of network services would not apply to those emergency circumstances.
So, Mark, you talked about having community providers on this is a question that has come through, community providers, at least on our health plan. Specific to our health plan, what if I can't get into my doctor in the time that I want to, and I want to see all of the doctors, whether it's community or in network, that I can see who has the least amount of wait time or who I can get in? How do I find out all the providers that are available to me?
So we have an online provider network that anybody can, if you go to the Living Whole website on our portal, you'll find that we have an online provider network. So you can, I think, search through that by city or by provider name or by specialty. And so you can find all of the providers that are contracted. We've contracted for providers in areas where we either don't have the capacity or we don't have that specific service available, within the Loma Linda system. Which is, again, pretty typical, I think, of what, large academic health centers do. So that information is readily available for patients. One other comment related is that if you're having a problem, whether it's our plan or any other, every plan will have a customer service desk. And so if you're bumping into those kind of issues, we're having difficulty getting an appointment or your care is being delayed or something of that nature, pick up the phone and call the customer service representative for that particular plan. We have a customer service desk here. And again, every plan does. And oftentimes there are additional resources that you can call upon to help you work your way through that process. HMOs, PPOs, every kind of a plan out there offers these kind of support services. Every plan wants their member to be happy. They want their member to get the care that they need. And so avail yourselves of those resources. I pick up the phone and call the customer service desk, and hopefully they'll be able to help you address the issue.
Great. And, if you are an employee of ours, you can call our customer service line as Mark referenced, and that number is 909-651-4010. That's 909-651-4010. Or you can visit our website at livingwhole.llu.edu. So we have one question left, Mark, that has come through for today's session, and that is regarding previous sickness. So if I have a pre-existing condition, what a lot of people have heard, what happens now if I have a pre-existing condition and I want to get health plan coverage?
Well, again, this is because of the Affordable Care Act, there were a lot of consumer protections adopted with that legislation. One of those was prohibiting so-called pre-existing condition exclusion. So a group health plan is sponsored by an employer, and generally speaking, all group health plans today have no pre-existing condition exclusion. So even if you're in poor health or you have an existing diagnosis, you can move from plan to plan, and you don't need to worry about that. You can transition from your plan to your spouse's plan or change plans, and you no longer have to worry about pre-existing condition exclusion. So that was a great improvement in consumer protection that was adopted with the Affordable Care Act back in 2010.
Mark, thank you so much for being our guest speaker today and for all the information you shared with us. And hopefully for all of our viewers, you're a little bit less intimidated by your health plan once we kind of break it down. It's a lot to know, but it is actually very understandable and important information. So if you'd like to share this video with your friends and family, I'd suggest that too. So I also want to invite you to our next session, which will be on September 28th, if you want to catch us live. And Dr. Ernie Medina will be sharing with us about a very important and very popular sport with a strange name called pickleball. So is pickleball the best intervention that public health has seen yet? Well, stay tuned and you won't want to miss the answer to that question. Well, my name is Dr. Olivia Moses. Thank you so much for joining us, and we'll see you next time.